The following portion of Living Local Carolina is sponsored by UNC Health Southeastern. Hey guys, welcome back to Living Local Carolina. Today I am at UNC Health Southeastern in the Orthopedics department, and I'm joined by Dr. Slauterbeck. Thanks for having me today.
Thanks for coming.
I want to learn all about you and why you chose your field in the first place.
Well, it starts when I was a kid. I fell and broke my arm when I was a little kid, and I wanted to be a bone setter.
Okay.
I didn't know what that meant, but all the way into high school, I decided that's what I really wanted to do in my life, and then I realized we had a team physician, and I really enjoyed having that. Team priest, team physician, both were pretty good.
Okay.
And then in college, I played football at Arizona State, and we had a team physician, and that's kind of where I fell in love with sports medicine.
Yeah, that's your specialty, right?
Yes.
So how exactly do you do that day to day?
So here, basically, I practice sports medicine in clinic 2 days a week, and I'm in the operating room 2 days a week. And we cover football on Friday nights, and we have a Saturday clinic.
You're busy.
Yes.
I'm glad you had some time to do this interview with me, honestly.
Thank you.
Well, what does a typical day look like for you when you're in the OR?
When I'm in the OR, I typically do 3 to 5 cases, a couple of
Okay.
knee ligament reconstructions or shoulder reconstruction, and then usually some smaller cases, usually meniscus, something easy and small.
Yeah, what are some of the conditions that you're treating most often?
So my athletes, I treat knee ligament injuries like an ACL
Okay.
tear, which I've done a lot of research on. And other injuries would be like a meniscus tear or a dislocated shoulder. So we take care of lots of knee joints and shoulder joints when they get injured in sports.
Do you have something that you enjoy doing more than others?
I love doing knee ligament reconstruction. So
Okay.
ACL surgery and my research passion has all been related to that.
Yeah, you've been teasing this research. We might
I
as well
know.
talk about it now. What research have you been doing? It's pretty fascinating, right?
It is. I was a fellow at UCLA, and
Cool.
6 of our girls tore their ACL in one season. And it started me down a pathway of trying to look at differences between males and females. And it looked at that time, I was looking at sex hormone differences and how women respond to estrogen and men are responding to testosterone. And it looks like in high school and beyond, girls are much more at risk for tearing their knee ligaments.
I'm not kidding. I've actually heard about this research. It's really cool.
It's very exciting.
And it's important too, I think, for women as well, because you got to know this sort of thing too if you're going to be an athlete.
Correct, and there's ways to prevent injuries. So FEEP
Yeah.
11 Plus is an amazing injury prevention program, and I've done some research in that area also, and it can decrease ACL injuries by 70%.
That's huge.
Yes.
Wow. Okay. What has been the most surprising part of your career so far?
I think I've been in academics my whole life, and I started as a vice chair and a program director, and I became chair at University of South Alabama. And I think the most surprising thing was kind of meeting that goal and being able to do what I really came and wanted to do.
You're always learning.
Always learning.
Love it. Well, what is the typical patient that you see here?
So usually a high school athlete, usually with a complaint of a knee pain. They often were running, cutting, or playing a sport, and they heard a pop, and their knee swelled up, and they were on crutches, and they come see me.
And what's the most rewarding part of your career?
Well, I think one of the reasons I chose sports medicine is kids get better, and they're very motivated to get back to their sport. And I love going to their games and watching them play and watching them recover. It was hard when I had kids in high school and watching them play because I was always like, don't get hurt.
So you let them play?
I did.
Okay.
Not
okay.
football, though.
Not football.
My son played
all
lacrosse.
right.
He was a state,
All right.
all-state in lacrosse, but he didn't want to play football.
Well, when you are not in the OR here or on the sidelines, where can people find you typically?
Out on my bike.
Out on your
bicycle
bike,
riding,
okay.
or at the gym working out. And I love to sail.
Do you have any sports teams that you're a big fan of?
I did some pro sports stuff in my career, but I mostly enjoy college. And so Arizona State's where I played, and UCLA I was a fellow. Those are kind of my 2 favorite areas.
I see what you mean. This portion of Living Local Carolina was sponsored by UNC Health Southeastern.